Hey team, welcome back to another episode of the Student Paramedic podcast. Hey team, welcome back to another episode of the Student Paramedic podcast. Today I'm sitting down with Dr. Jo Stevens again. If you haven't already yet done so, make sure you go and listen to our first episode together to go have a listen and learn about Jo and her amazing experience in the profession. So today we're going to talk about autism, and autism is something that Jo has the experience of from a mother's perspective, but as well as a clinician. She did do a PhD in the paramedics approach and response to patients with autism. So, Jo, thank you for coming on today, and I'd like you to briefly introduce yourself yet again for those who haven't listened yet to our first episode, and then go into your experience with autism and I guess that definition of what is autism.
Sure. Thanks, Alex. And thanks again for having me. I'm really appreciative of your time and that people are willing to learn about this. So briefly, I worked for the QS for quite a number of years. I've been at QT as an academic for about 11 years now. And I've had the great privilege of being a mum of a young person with autism. So he's nearly 19 now. And he's taken all of our family and friends on a terrific journey. And it's only with the benefit of, a lot of reflection that I can really see, just how much he's changed our lives for the better. It's been an amazing journey. So I just want to say at the outset that my lens is that of a parent, and I don't speak for people with autism. So these are just my learnings and perspectives. And we should always understand the ideas of people with autism, and they talk about nothing about us without us. So I would really like people to always talk with a person with autism first and foremost, and hear their perspectives. So asking each individual person with autism what they need is so important, so listening to their voice. And I'd like to start a discussion today with the notion that to meet one person with autism is to meet that one person with autism. And that was, coined by Professor Stephen Shaw, who's a person with autism, and he's an academic in America. He teaches into education. So I guess I wanted to talk about autism from a couple of perspectives. So the first is the medical model, which paramedics are very used to. It's a very comfortable space for all of us. And then perhaps talk about it from a neurodiversity perspective, because they're quite different. So the medical model, how is autism diagnosed? I thought I'd mention that. So that's the DSM-5, which you've probably heard of, Alex, I imagine.
Yes.
Yeah. And so briefly, what they talk about is two particular perspectives. So one is that it's usually a child, but not always a child that's diagnosed. So they'll have two things, challenges with social communication, and then one with restricted, repetitive, and or sensory behaviours or interests. And typically people are going to be diagnosed by a developmental paediatrician, which is the preference, but could also be a paediatrician, a psychiatrist, and a speech pathologist, also a psychologist, if I didn't say that already. And they need to have challenges in both of those areas, and they've had to have had characteristics from early childhood, or at least if they're not picked up immediately after, that there's a reference to, I do remember when I did this as a young person, or that the family might remember. So I thought I'd give a couple of, examples of what those two particular criteria might be. So where we're looking at difficulties in social communication, it might be that the child's not sharing interests or achievements with parents. So that, you might get a little person that says, look, there's a plane. So that sort of shared interest, so they don't do things like that. Not showing an interest in having friends or having difficulties making friends. Really using language to communicate with other children or other people, and, often challenges with eye contact. Now, there's many others, but that's just sort of, the main ones that I've sort of noticed. And examples of restricted and repetitive and sensory behaviours or interests might include lining toys up in a particular way over and over again, speaking in a repetitive way, needing things to happen in the same way, repetitive body movements. And one that really sticks out for me from my lived experiences with my son is hypersensitivity to things like sounds and textures and visuals, so being quite affected by the environment. Also of note for paramedics, I guess, because parents will often talk about the severity ranking, which I really dislike myself as a parent, because people are so much more than a ranking or a level of, difficulty. So I guess if we were looking at that, a level 1 is a child that needs support. A level 2 is a child that needs substantial support. And then level 3 is children that need very substantial support. And I guess they use that often in therapies, so speech pathology, OT, psychology, and definitely in schools. Paediatricians and developmental paediatricians and GPs will often sort of talk about those things. Is it worthwhile talking about some statistics, do you think, Alex?
Yeah, absolutely. Just to get an idea about, I guess, the clinical significance for us, like when we're going out on the road and, what would be the likelihood of us, going to a patient with autism. It'd be good to know those statistics.
Yeah. So this was a report done in 2015, so it's a little old, but I'm guessing because of COVID, perhaps some statistics haven't been captured, but the Australian Institute for Health and Welfare suggested about 164,000 people had a diagnosis, and I'm sort of emphasising that word because there's lots of people in our community who have not been diagnosed and perhaps might tick all those boxes that are required for a diagnosis. So that sort of suggests about 1 in 150 Australians are diagnosed as autistic. And they suggest about a 4-to-1 ratio of boys to girls. So it's more likely that a boy will be diagnosed with autism than a girl, although girls are quite difficult to diagnose. And there's, again, I could talk about this for a week, but there's lots of different reasons why it's harder for girls. But if you want to have a look at the literature, it's available. So I guess wanted to share the ideas about neurodiversity. So this is shared with us by people in the autism community. So they say, and I agree with this too, that autism doesn't need to be cured. That people in the autism community argue that they're not disordered, but rather that being autistic is an identity, sort of very much like having physical attributes like, eye colour and hair colour. The ideas around neurodiversity are growing stronger amongst people in the autism community in academic research in other areas as well. And many workplaces are discovering the significant contribution that autistic people can make and bringing particular attributes that are valued by the organisation. So things like noticing patterns, detail-orientated people, focused and punctual, like every workplace would like a punctual, focused person.
Absolutely.
So people are more likely to be employed in IT, software design, perhaps the Bureau of Statistics, so where there's numbers and things like that. There's a lot of people working in the IT industry for banks and the Australian Taxation Office where they can pick up patterns of fraudulent behaviours and things like that. So that's a skill. And I know for sure with the research that I've done and the people I've interacted with that there's lots of people that contribute to music and, art and dance and design of buildings and engineering. It's really, really impressive. So a lot of attributes that are really, very beneficial to our lives. I heard a speaker called John Elder Robson a long time ago at a conference. He's an American. Interestingly enough, he was someone who designed all the guitars for Kiss. I don't know if you remember Kiss, it was a long time ago. They used to have all the fires coming out of the guitars and that kind of thing. He did all that design. He was just a really interesting guy. And he talked about neurodiversity as the idea that neurological differences like autism are the result of normal natural variation in the human genome. And it represents new and fundamentally different ways of looking at conditions that were traditionally pathologized. And it's a viewpoint that's not universally accepted, although increasingly supported by science. And I find this really interesting concept. It might be new to some people as well, that science suggests conditions like autism have a stable prevalence in human society as far back as we can measure. And we're realising that autism and other conditions emerge through a combination of genetic predisposition and environmental interaction that are not the result of disease or injury. So as far back, they suggest, as we've been around, people with autism have been contributing to community, being part of community, loved and valued by their family and friends.
Absolutely. That's a really good way of putting it, and definitely a new concept for even myself, as I've not actually learnt a whole lot about it. And I loved reading, so I did read your thesis as well. And
wow.
not everything. the main points that would obviously everything would be relevant for this podcast, but the main points just to get an overall understanding. And some of the things that I read in there, particularly, it was even at the start, but the fact that children with autism generally will experience illness and injury at a higher rate than those without, and they also experience more comorbidities. And I just want to ask you, sort of from a paramedic standpoint, what would we sort of be going to in terms of those comorbidities, illness and injuries?
Yeah, look, there's actually quite a few. And I thought I'd sort of list for you the larger types of things that you might go to and see and hear about, mainly because with that comes a lot of challenge usually in the way that someone might present. There's a lot of emotion usually. So some of the things I thought I'd mention, there's a fair degree of comorbid mental health conditions. So I just wanted to emphasise that autism is not actually, even though it's in the DSM-5, it's not actually a mental health condition. However, about 70% of people, and particularly as older people, so, adolescents and young adults are more likely to develop mental health conditions such as anxiety and depression mainly. And if you think about the disposition of people and how they're treated by the community, and a lot of people have trouble at school with other kids and that kind of thing, might be as a result of loneliness and inability to really communicate the needs that you might have. Might be low self-esteem, bullying and teasing, and social isolation and social skills challenges. So that's a really big part, I think, of what we do. And sometimes families are quite affected by the person they love with autism. So that can be quite challenging and I think quite misunderstood. Another big thing that I've noticed, so I still have family members working for the ambulance service, and I'm hearing that there's, for example, there might be some behaviours that are viewed as violent. So if you're getting a 6-year-old violent patient on scene, if it were me as a paramedic, I'd be thinking, I wonder what that's about. For me, that's kind of like a tell. I'm not saying it's unusual. It is unusual for a 6-year-old to be violent, but, it's about interpretation of scene and that kind of thing. But if you've got perhaps a mum or a dad saying, my son Johnny is being violent, he has autism, you kind of start thinking about, I wonder what's going on there. So the sorts of things you might get called to are violence on scene or unsocial behaviours or strange behaviours or self-injurious behaviours. And there's a term that's used in the autistic community called meltdown, and I might just mention a bit about that. So I guess if you were to just briefly think about a 2-year-old having a tantrum. So they're in the supermarket, gone past the chocolate aisle, and they want a chocolate, and mum or dad or grandma says no. So they might fall down on the ground and flail around and cry and scream and carry on and make a really big scene. The difference is that they're aware of who's present and who's observing their behaviour. So I'd just like to put it out there that might be like your toddler behaviour. But when someone with autism is having a meltdown, they're unaware who's present and they don't register the reactions of other people to their behaviours. And it comes from a feeling of being completely overwhelmed. It's a loss of control, and perhaps, I'd like people to think about it as like a panic attack for someone. So you can't, if you're having a panic attack, you can't actually control that. You can't control the feeling in your chest and it feels like you're having a heart attack, right? So even though the symptoms and the way someone might present is different, it's the same kind of thing. No one can control a panic attack. A person with autism can't control a meltdown. So it's that sense of feeling completely overwhelmed, and it's often triggered, but can be other things by the environment. So I think that's important. So moving on to injury, lots of people with autism have quite poor fine and gross motor issues. So they have motor apraxia and they might have toe walking and that kind of thing. So you can appreciate that, tripping upstairs, falling down, falling off things. If you haven't got great control of your body, you might fall off the trampoline and that kind of thing. Another thing that I've noticed is young people not being able to perceive risk very well. So they might just walk across the road and there might, be cars coming and they're unaware of the cars. So you'll get a young person, being run over or backed into and that kind of thing. Self-interest behaviour is another thing, and that's in response to a stimuli, usually. They've got a high rate of injury around the face, neck and head, so traumatic brain injury can be a consequence of that. And then illness, so many things. So they suggest about 70% of people with autism may develop seizure activity, so epilepsy, and lots with anaphylaxis and severe allergy, so you're more likely to have that. Definitely lots of gastrointestinal problems, and again, if I had a week, we could unpack all that. More likely to develop type 2 diabetes down the track with, a sense of not knowing when you're full and eating, or having a particular kind of diet because of the sensory feedback that you get from particular foods. So a lot of people have very restricted food groups. So they might be things like crunchy food, so things like rice crackers, apples, that kind of thing. For some people, they'll only eat white things. So, chips, like hot chips, so yummy, but so good, so bad for you. And, chicken nuggets or something like that, white bread. So you can appreciate that over a lifetime, that's going to create some quite significant challenges. And it's not that, people might actually be quite, as they get older, understand the value of good food, but just cannot actually put it past their mouth. It's just not something they can do. And so the main thing I wanted to mention here is that unmet needs are more likely to produce some behaviours that are considered to be violent or unsavoury. But really what that could be is that people might have some really significant underlying illness or disease process going on, because they might be less likely to be involved in immunisations, screening for things like cancer. Routine dental visits are traumatic for people, so they might have actually quite significant periodontal disease, which, as you can appreciate, if you've got an evolving abscess and that kind of thing, huge amount of pain, not going to be eating. If you don't have great communication, it's hard to explain what's going on, the pain and that kind of thing. Lots of undetected UTIs, especially as people get older. So the person might actually present with some unusual behaviours or behaviours that aren't usual for them. So it's really important down the track. We'll talk about it, getting a good history. So I think that's really important. Another thing I just wanted to mention that I think is really important is that paramedics really need to have a good knowledge of restrictive practices legislation. I'd really like people to double think about whether they really need to be giving someone sedation for behaviours when, if you've got, for example, the abscess in the tooth and someone's really behaving in a different way, I want people to really think about, I wonder what's actually going on. How might I elicit that information? And is there something underlying that's sort of suggesting that behaviour is present? Because when we chemically sedate someone, we know that we're taking away their rights, and there's usually a reason for it, right? But I want people to think about what's the immediate short-term and long-term effects to the person if they're being held down, if there's police jumping on top of them. What are the effects to the family and to you and the crew as well? So if you've got one bad experience, because people if I use my son in this example, memory is unbelievable of any tiny little mistreatment that he's perceived. And so if he has one bad experience with a health provider, it's going to be the same with others coming. So we're really wanting to look after that person to have a good experience with health providers in whatever way, shape or form that is, so that the next experience might actually be a growth thing rather than a negative experience. I also just want to mention here that certainly in my research, it was mentioned many times about parents when they call for an ambulance, that sometimes police will be called, especially where there's violence on scene, and they would lay awake at night, sometimes sobbing, thinking about the ideas that what would happen if their young person got arrested, not because they didn't mean to be violent. It's just that, they were having a meltdown or whatever the case may be, and they were arrested or shot in the back. It's a really great fear that people have for their young person. So I just really want people to think about those kinds of things. And often when families are calling paramedics, especially if it's a behavioural related thing, they're calling because they've got to the end of their tether. They really don't know where else to turn. And because paramedics are 24/7, it's usually a gentle and kind response. That's the way they perceive paramedics. They've got such a great perspective and sense of what paramedics do and what they can deliver, that they're really asking for help. It's a cry for help for the family, but also for that person as well. So, ask the family, have a look at the family dynamics and how are they? Like, what do you need? What's going on for you? There's a lot of unmet need out there and a lot of access issues to health services and other services that they need. So they're really concerned about all that kind of stuff. I really think we're always going to be talking to the person themselves, but ask the family as well, with the consent of the person, what are the triggers that this person might experience? So it might be noise or light or too many people or new people, might be changes to schedules, because a lot of people with autism really like sameness and routine and something I can expect. What are the strategies that they usually use to manage situations? Has there been a temperature change? Is there like a new jumper that's really bothering that person? So I think that's, those things are really important to take into consideration.
Absolutely. And just mentioning that, so when we would go on scene, how can we de-escalate and, I guess, approach that patient who may be having a trigger for something as well? How can we de-escalate that scene so that we do ensure that they have a good experience with us?
Yeah, if I can share one brief example, there's a person that participated in my study. There's a paramedic, happened to have a young person in their own lives who's autistic. So this paramedic was sent to, I can't remember exactly what the situation was, but the young person was, I think it was termed going off, so having a meltdown. Parents were beside themselves, calling for, paramedics to come. It's a little person. And the little person, by the time, apparently there'd been things thrown around and whatnot, and the little person was standing up the top of the stairs with a pack of cards in their hand. And this paramedic noticed the cards. Mum and Dad were beside themselves, and so one paramedic was talking with them, and then this paramedic went up to the child and said, "I really like do you want to play with me?" And apparently went from 10 to 0 and just started playing And so the paramedic was able to hear the other paramedic talking to the family and calming them down and talking with them. And the paramedic just kept playing the cards, and this child was just okay. So something had happened where it was overwhelming, and then at the moment that someone took a little bit of interest with their interest, things changed. So that's just one example. And there'll be, I think it's really just paramedics are very, very good at assessing scene safety. They're also very good at noticing the environment and noticing what might tick someone off or what might actually settle them. So I think listening to those, your internal dialogue and your voice about what's feeling safe, what's feeling possible, trying a few different things, and everyone's going to be different. So I can't really give you a generic response to this, but just some ideas that I sort of came up with. I think it's really important for paramedics to advocate. So that's not just on scene. So if police turn up or other services turn up, advocate for the patient always, because we're very, very good at that. In the ambulance and also at the hospital is a really important place to advocate, because as we know, especially the EDs, they're so busy, they're noisy, there's things binging and bopping and alarming. There's often people screaming and carrying on. So thinking about the sensory and communication needs of the person. People with autism are heterogeneous, and so they're not all the same. So thinking about asking them, what do you need? And titrating your communication. So if they can't respond, ask their consent. Is it okay if I talk with mum or dad or carer or whoever's with them? Especially with the sensory environment, ask the person what they need and try and make that happen. So often we can manipulate our own environment in the ambulance. That might be turning down the lights or dimming the lights, giving the person a blanket if that's what they want to hide. Some people just like the blocks off noise and light and movement. Maybe they want to bring a hat, glasses. Maybe they want to bring some music. Maybe you've got some music. What do you like? Maybe you've got something on your phone. Most paramedics these days have a phone or something. So you might have a video or some music or something they like. I think one of the biggest things is people with autism, when they're distressed, and they will be if they're ill or they're injured or they're having a meltdown and that kind of thing, need more time to process information usually. So I don't talk about making things simple, just, concrete terms are best to use. Give people time and patience in order to process the information and then give you a response. They need your understanding. They need your non-judgment. And I'd really like paramedics to acknowledge their humanity and the strengths and the things that they bring. People with autism have families. Acknowledge their strengths and accomplishments. Non-judgmental stance is really important. Communicate your understanding and ask what you need, because often, people have been doing this for a very long time, and it's a very long time to be able to, help someone when things are really challenging. And, my experience of my own son is that it was really challenging when he was little, and we were learning who he was, and then learning also about autism and learning how to get through the environments and our day-to-day living things. And I look at him now at nearly 19 as a completely different person. But I think of all the time and energy that he used in trying to develop his own strategies of being in the world, and all the people that helped him with that. It wasn't just us, there was so many others. And so I am always talking with families about how their 2-year-old doesn't suggest, that's really struggling to be in the world, isn't necessarily going to be a struggling 50-year-old in the world. But there are always going to be some things that as health professionals we might need to be cognizant of to make things easier. If we think back at the Australian Charter of Health Rights, we're always looking at the rights of the person. They have a right to be included in their care. They have a right to make some plans, with a health worker. They have a right to be treated with respect and dignity and acceptance as well. So I think that's really important. If I may, I've got a few ideas from people with autism that I've read.
Absolutely, that'd be amazing.
Yeah. So this is from the Autistic Self-Advocacy Network, and it's people with autism sharing their ideas about why the community needs to accept and understand autism. And this includes particularly health providers, because, what I hear from people with autism and their families is often that they love paramedics. Paramedics are probably one of the most, trusted health providers that they'll have connection to, often their own GP when they find a good one as well. But this isn't necessarily shared by everyone in the community. So they suggest that because autistic people are friends, family members, children, partners, co-workers, fellow citizens, customers and neighbours, they have a right to be valued in the world. Autism is a natural part of the human experience. autistic rights are human rights. I think that's a really nice one. Autistic people can speak for themselves, and they want people to listen to their voices. They're not going anywhere. They're here to stay. We all share the world together, and because the world needs all kinds of minds, and the world's big enough for all of us. And I spoke with my son, telling him that I was going to be doing this, and he gave his perspective, if that's okay to offer, Alex.
Absolutely.
So he said, listen to me first. It's my life. When you're talking with me, talk with my family if I give consent. Sometimes they can help me find the words I want to use. I've got so much to contribute to the world. Take the time to get to know me. Assume competence. So I helped him with that word. He didn't use that word, but I talked about what that meant. And he said, an IQ test, so the number that he's ascribed doesn't define him. I thought that was really important. Some other things that might be useful for people if they want to look up some TED Talks, because I know I actually am quite connected with lots of paramedics, and there's lots of paramedics out there that have got either little people on the autism spectrum, or they've got big people on the autism spectrum. So they like the ideas of being able to read and, hear different views. So Dr. Wendy Chung did a TED Talk on autism, what we know and what we don't yet know. Steve Silberman provides the forgotten history of autism. He also wrote a book called Neurotribes, which is just fascinating. It's a really big, thick, doorstop kind of book, but, if you're interested, have a read. And Rosie King, How Autism Freed Me to Be Myself. It's another one. Also wanted to just mention that the Autism CRC has a health hub, of which when I was still working with the ambulance service in Queensland, our team developed what we called a communication board. So it can be found under there. Even if you just Google search communication board paramedics, you'd find it. And that's a really useful tool to have in your toolkit. But there's lots and lots of other ideas out there. And I'm really delighted to see that there's more and more interest in our space as paramedics. So, by all means, have a look, do some searches.
Absolutely. I'll pop all of what you said regarding the TED Talks and the CRC. I'll pop that into the show notes as a link so that people can go have a look. Because I think absolutely, it's something that, as we say, you can't learn absolutely everything at uni, and so it's important to go and do your own research about things. So a big advocate for going and having a look and broadening your own knowledge and your horizons there. I thought what you said then about their perspectives, so all of the people, even your son, who shared, what their thoughts were, that was incredible. And it's just a nice reminder that, like what you said last time in the last episode, treating people, they're not patients, they're people. I think that's really important. That's a really important piece. Going into, as we said, make sure you have consent from your patient with autism or your person with autism to talk to their family, particularly for your younger people who, your family will be your main point of contact and questioning. What sort of things should we be asking them? That's sort of question one. But then number two also is I mentioned it prior off air about something you wrote in your paper as well that said parents and families are vulnerable as well and they're at risk of getting their own health conditions. And I'd like you to talk about that a little bit as well if you're happy to do that.
Yeah, so just remind me of the first part of the question.
So that line of questioning you'd ask the parents. So we did talk about before about the triggers, but is there anything else that we'd want to know from the parents?
Yeah, so you might be interested in, again, you need to be careful about how you ask these questions. So you might want to know the social situation, who's there, who's important, what the person, obviously the usual things like medication history, diagnostic history, surgical history, if it's behavioural, what's been going on for the young person, has there been something going on at school? School's quite a significant part of any child's life, but certainly can provide some challenges for young people with autism for the things I've mentioned about, loneliness and social isolation, that kind of thing. What have they been eating and drinking? Are they allergic to anything? Maybe try and work out, without sort of pushing some psychology ideas on you, what happened before the incident. So if it's a behavioural thing, for example, it might have been that mum or dad said, no, you can't have 2-minute noodles for dinner, and then everything just changed. Because maybe that young person had been promised the 2-minute noodles and had been looking forward to that, or maybe the idea of having a stew with all the things together in one plate is more than that person can bear. So you know what I mean? What's the precursor to the behaviour, and what might change that? So if mum and dad are not terribly worried, like it's, someone's threatening to jump off the roof or whatever because the 2-minute noodles were not available, and in usual response to childhood behaviours about that, it'd be like, well, too bad, so to put up with it. But, really, is there going to be a problem in having the 2-minute noodles? Probably not. And then it might just calm things down. And then can be some other strategies that the parents do long term, which is not part of the paramedic, practice here. But there might just be some opportunity to go, oh, I wonder, is Johnny seeing a psychologist? I wonder if that might be some strategies that you could build up. Just a thought. I'm offering that lightly because, of course, we're not psychologists. I think really getting a good idea of the behaviours and a really full comprehensive history. Lots of little people aren't going to let you near them with blood pressure cuffs and that kind of thing. So what other ways? So I often use, bears and things like that. Whatever their toy is, or Thomas the Tank Engine. I wonder if we could put the SpO2 probe on, or I wonder if we can put the blood pressure cuff on Dad, or whatever the case may be. I sort of make a bit of a light joke of it. Sometimes I might even put it on my partner and, do that and get them to take a video on their phone, or whatever the case may be. So sometimes it's just, if it's someone that you go to a lot, maybe you could do some stuff, go around there at some point if you're not busy. I mean, you always are, but if there was a time, I don't mean just go in your days off, but perhaps, say to mum or dad, we come here a little bit. I wonder if this could be an option, or you come to the station and have a look through the station and the ambulance. So the other lines of questioning is, how are you going, mum and dad? How's everything for you? What are the things that you're accessing? Are you having any trouble accessing the care that your young person needs? And if you go from that approach, it might be surprising what they'll come out with. Lots of people I find are very private, and they try and sort things out themselves, but sometimes parents' mental health can be affected by, and often there might be more than one person with autism in the family. So I met a family in a regional place I worked at she had 6 children on the autism spectrum, and after the 4th or 5th child, I think her husband was diagnosed with autism. That's a fairly common thing too. So, and all with different needs, and all with different attributes, and all with different contributions and strengths. So, that's a lot to have 6 children and a spouse on the autism spectrum.
Yeah. Wow. And actually, funny you say that. Even on a case on placement, I had, going to this elderly couple, and they still had their 2 children living with them, and they were both on the autism spectrum. And, you could see that them, like they've had, struggles, and talking to them, like their health sort of has declined. And it's really interesting to look at that dynamic and go, like, what sort of supports do you guys have, and wanting to advocate?
Yeah, and I think that's so important, and we need to be that conduit, as I've always talked about, between what that person or the family is needing when we get to hospital, if that's where we're going. I think also I just want to mention that maybe hospital isn't the best place either. So I wonder who else is a trusted health professional that might be able to help this young person or family with what's going on. And typically that could be a GP. who can then outsource some other people. So I think that's what I like to think about the role of paramedic is often it can just be, helping to understand what's going on and then providing the conduit in order to enable the family to get the support that they need. I think it's a very common idea, and I certainly have had it. I don't feel it as much anymore, but what will happen when I die and what happens if I die early? And lots of families feel that weight because no one could love or care for my young person as much as I can. And so what are the supports available to help people keep going on? I think that's really important. And when your young person is misunderstood, I think that's worse because you just are concerned all the time about what will happen to them. Could they possibly have that good quality of life that you want for all of your children? And so when people age, as I imagine this is what you're talking about with the family you saw, if you're in your 80s and you've still got your 50, 60-year-old child, adult child or children with autism or other disabilities, it's a very big concern for families, and especially as their health starts to fail themselves, or the other spouse has got some health conditions. So I think reaching out and getting some help for people is really, really important, because most people, this is, I guess, the work that I do a lot of informal stuff outside of the university, is really just helping people to strengthen their family and to know that what's possible, that it's actually it can be so different to what other health professionals who see it as a huge, challenge, that in fact people can have great quality of life. But we definitely need to know what the supports are around for our person and what they are for the family, because I think once supports are there, families are strengthened and can actually have quite a good quality of life. So.
Absolutely. And do you recommend for everyone listening to definitely go and learn a bit about what sort of resource, or go look at different resources to understand what sort of supports are out there and, how they can best contribute when they're...
Yeah, I think it's really interesting that a lot of families still don't know much about the National Disability Insurance Scheme. That's the NDIS, and it's often on the media. I don't think that paramedics need to know that in depth, but to have an idea of how someone might connect with it, like even just maybe to have the website, because a lot of people don't know how to access it. And it can feel quite complicated for families and a person with a disability to get the access. But certainly worthwhile just having that. But I don't think paramedics need to show people how to navigate that. There's other people around that can do that. I think certainly to know a little bit about autism is useful. In my research, often paramedics they didn't know themselves, and we didn't have much, certainly when I went through my paramedic program, and I only learned because I was a parent, because as lots of people do. It's important just to have a good understanding of it, but also, like I said, to just individually ask someone. But lots of paramedics were, accessing their auntie who was a teacher, or their cousin who was a speech pathologist, and that kind of thing. I think that's great. I think that shows such adaptability and flexibility and resourcefulness in paramedics, and that's what I love about our group of people, is that mostly they're pretty good. They're pretty good socially, and they're pretty good at connecting people and helping people to find what they need. I really love, I've heard from some of the LaRue officers, or low acuity or extended care in other places, and a lot of them have some good relationships and been very helpful. That was certainly my research, to people who were loving and caring for a person with autism. So I think a lot of them also sort of self-resourced and just worked things out. I think it was great.
Yeah, that's definitely amazing. And I know you've done a lot of preparation, for this episode today, and I'm hoping we got through all the things you wanted to talk about. But just in sort of, I guess, a final summary, or do you have any things that you'd definitely just love to portray to everyone that's listening at the moment?
Yeah, take-home message, I've said it a couple of times now, but to know one person with autism is to know one person. Please don't look at it as a deficit, as a medical model perspective. People are valued and loved by their families and their communities. They have lots to contribute. There's more strengths in having autism than there is, challenges. I think when little people are little with autism, there's lots that can be done to develop the person, to develop strategies and self-soothing and all the things that we spend a lot of time with our young people doing. But I think true acceptance is just, looking at the humanity of any person that you provide care to. And this group of people is no different. So I think if you come in with your good heart, with your good grace as a paramedic, and you listen and take the time, you don't necessarily have to put yourself in other people's shoes because it's almost impossible to do that, but just be there when people really need you, and start thinking laterally about when you go to someone. Think about the 6-year-old that you're called to with violence on scene. It's unlikely he or she is going to clock you in the head deliberately. So I wonder what's going on for that person and that family, and just keep in mind that when families call you, it's often at a time of crisis when they really need some support. So think more than just the person you've been called to. Think more broadly about the family as well. It's really, really important. We're such trusted people in the community, and this group of people, no different. They just love paramedics. They really do. Everyone I've ever talked to really just never said anything bad about paramedics.
Well, that's amazing. Thank you so much for being very open and going through all of that today. I will just remind everyone to, go down into the show notes. We'll pop in all those links that we've spoken about today and check those out. And, well, thank you so much.
Thanks so much, Alex. I appreciate this.
Thanks for listening to this episode of the Student Paramedic Podcast. You can connect with us on Instagram, Facebook, Twitter, or you can email us at thestudentparamedicpodcast@gmail.com.